National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Dr. Jonathan Beatty, naturopathic doctor and a health expert here at nationalnutrition.ca. Vertigo is a very serious condition or symptom that can affect a lot of people. It can be a minor annoyance to very severely debilitating, depending on the severity of the vertigo you experience. What vertigo is essentially a sensation of spinning or loss of balance, and it can be caused by a number of things. So if you do suffer from vertigo, it is important that you get it checked out, because depending on the cause, not only can the vertigo worsen, but it can actually be a sign of a very serious medical condition. So it's best to get it evaluated early so that you can get the appropriate medical intervention as soon as possible. So there's a number of different causes behind vertigo. Probably one of the most common is an inner ear infection. So the inner ear is the portion of your ear that's actually in charge of figuring out where your body lies in space. So what we provide is what we call kinesthesia, or that sensation of where you are in space. So as you can imagine, when the inner ear gets infected or inflamed, it loses its ability to do its job properly. You start getting mixed messages sent to the brain. The brain can't figure out or resolve where it is in space, and that leaves you with that sensation of vertigo. Other causes can again be damage to the nerves that convey that message to the brain. So that could be caused by tumors or cysts or other things, what we call space-occupying lesions. And this is why it's so important that at early vertigo you get diagnosed, because it could be a sign of a more severe condition that needs to be addressed. Other causes of vertigo can be related to symptoms from certain nutrient deficiencies. Anemia can actually present with vertigo-like symptoms, and again, that could be as simple as an iron or a B12 deficiency that needs to be corrected. And then some people even have a diagnosis, I see it all the time in my office, something they call benign paroxysmal positional vertigo. What that is it's vertigo that seems to kind of come and go on its own, and they really don't understand what creates the symptom. And so that's what we would always call a diagnosis of exclusion. For me, anytime I see people with that BPPV diagnosis, I want to look a little further at what might be creating the problem. I've seen cases of food allergies that seem to irritate the inner ear for whatever reason, and sometimes I've actually had patients whose vertigo goes away with dietary changes. So that's why it's always important to work with your healthcare practitioner until you get a solution to your problem, as opposed to just trying to manage the symptoms all the time. It's really the important aspect of healthcare is figuring out the cause of your disease, because yes, it could be related to something minor like a vertigo that you could take a medication to manage the symptom of. But if it's something like a nutrient deficiency creating that, at the same time that nutrient deficiency is also going to be creating more severe disease that could have other effects. And this is why it's important that we get at the underlying cause of disease. So if you do suffer from vertigo, there's a couple of things that you could consider utilizing. In some cases, due to poor blood flow to areas of the brain, that can lead to vertigo. In this case, something like Ginkgo Biloba can be very, very effective, as it improves microcirculation and improves circulation of blood to the brain, which has actually been shown in some studies to alleviate certain types of vertigo. Again, if you've got that inner ear infection or inflammation, look to the cause of that, and you may need an antibiotic therapy, be that pharmaceutical or natural, to clear up the infection, and that can help get rid of the vertigo. Sometimes digestive concerns are related to vertigo. So vertigo can be associated with nausea, and in more severe cases, even with vomiting. And with that, things like ginger have been shown to be effective at reducing the associated nausea and vomiting that can come with a vertigo episode. So while you're trying to still uncover the cause of your vertigo, ginger may be an effective way to at least help alleviate some of the symptoms. So if you suffer from vertigo, I hope this video has helped you at least start to figure out possible causes, and you can work with your healthcare practitioner to develop a strategic plan on how you can get rid of your condition. Any questions or comments can be posted below. There are more videos like this available on our YouTube channel, so you can subscribe to that so that you can get updates about them all. And as always, the one thing you got to remember, knowledge is health.